My name is Grażyna Pawlowicz. I'm from G.B.R County Health Department, Environmental Health. And our division has been working very closely with governmental agencies and community on addressing environmental contamination issues and concerns since at least early 1980s. And we have a lot of programs related to environment and environmental issues. For example, we heard about concerns and issues related to landfills. Environmental Health, our program, did extensive survey of the landfill sites in G.B.R County and how we evaluated how community living nearby the sites can be exposed to this site and what contamination these landfills can cause and impact adversely the community. So we were looking and doing the evaluations and also talking with the residents how they are using the site, what they are doing, if they are accessing the site or not, and if they are, for example, using the private drinking water wells, and which might be impacted by contamination generated by the site. So we were evaluating the impacts of the landfills and were actually even taking some soil and drinking water samples around such sites to see if they have been adversely impacted by the contaminated sites. And for example, if the drinking water wells were it had the contamination and we determined that it was unsafe for human consumption, we worked very closely with the Department of Environmental Protection in extending the city water lines or installation, or we installed the filter systems designed to remove the contamination which we found to make sure that people have the safe drinking water source. And this is done free of charge to the residents who are impacted by this contamination. So we looked at the landfills. We heard about the incinerators and the ash sites. G.B.R County Health Department conducted quite extensive study around sites and the impact on children, which are the most vulnerable to lead contamination. So we tested thousands of children who are living around such sites to see if there is, if they have been impacted, and if we have many cases or any cases of lead poisoning around the children. Fortunately, we didn't find any difference in how many children are impacted by ash sites versus other portions of the G.B.R County. And we also, in G.B.R County Health Department has the Childhood Lead Poisoning Prevention Program and Healthy Homes Program, which under this program we evaluate, for example, if there is the residents who calls us and is concerned about their, they are saying, for example, that most of the, for example, if they have the children with asthma or many family members are sick, they want us to evaluate the condition of the home and their environment to see what it might be impacting the health. We go there and we do the healthy home assessment to see what can be causing, for example, the asthma incidence of the children. So